presentation on. Mike?
Thank you very much, Jed. Just wanted to welcome everybody and just express from the perspective of Family Medicine for America's Health, which is a consortium of all the family medicine organizations in the United States that have got together to develop a strategic plan on how to improve primary care delivery and access across our country. And we're happy to join the Primary Care Innovators Network because the alignment of what Jed and Larry and others in the network have been working on to bring primary care into a much more prominent role is something that we really firmly believe in. And in the work that we did in our strategic planning, we found that being able to pay for primary care in a comprehensive way was one of the key strategies that we felt was important in allowing patients and payers to actually kind of maximize the value of primary care instead of doing things in a fee-for-service model where the incentives are really not as well aligned as what we can see with the comprehensive payment models. We felt like that was the kind of linchpin in transforming primary care delivery. So our engagement with PCIN has been to promote innovative payment models, especially those that really do support comprehensive primary care payment. So we're glad to be supporting this, and we are looking forward to our continued engagement in the future.
Excellent. Thank you, Dr. Tuggy. I appreciate that. And this is a continuation of a conversation that began back in June in Arlington, Virginia at the Direct Primary Care Summit. We organized an hour-and-a-half session in order to talk about the potential for direct primary care model practices to work more collaboratively, more directly with employers, and in particular self-funded employers, given the level of control they have over what gets paid and how it gets paid. Many of them don't realize it, but when you walk them through the process and their status as a self-funded employer, they begin to realize that they genuinely have this opportunity to pay for care differently. And frankly, we suggest that they view primary care as not so much of a payment for something, but an investment in something. And so based upon the feedback that we got from that session and the conversation we've had with others following that, we wanted to put this webinar series together, again, to focus on particular aspects of working with employers. And so today's session is going to talk about giving employers what they want. And at the end of the day, what they want simplistically is a healthier workforce that are prudent consumers of healthcare services. So what what we'd like to do as part of this conversation is to put it in the context of wellness. And so we're going to use the term wellness in the broadest possible way. And so what employers need, and it's the same thing in the medical field. They're facing many challenges that they need to overcome in order to be successful, in order to be competitive, in order to improve their bottom lines, when they realize that the second biggest expense they have is health benefits, and health benefits are often driven in a negative direction, frankly, based upon the lack of wellness, if you will, among their population, poor health status, poor behaviors. And so they need to overcome that in order to become more successful, more competitive in whatever their business is. So this session will focus specifically on wellness, but we're going to make this a pretty broad conversation as you begin to see it unfold here. And the opportunity that you might have as a direct primary care, community-based direct primary care model practice to actually replace the programs that are currently being purchased by these employers. As we call it, helping them spend the same or less money more intelligently to repurpose the monies that they have been spending and figure out ways to drive those funds into primary care, again, as an investment, but nevertheless, a more coordinated effort. So what are employers looking for in wellness solutions? Well, we'll talk about that as well. What type of wellness solutions are they actually buying? Well, we'll talk about that as well. And then finally, we really want to offer some thought around how the best way for you to align what you can do with what employers want and what their covered individuals need. So when we take a step back and look at the history of employer-based wellness efforts, well, we see a variety of different paths dating from different points in time. I mean, the post-World War II effort was focused predominantly on business executives in order to really drive high levels of performance. The feeling was that if you focused on the managers, the leaders of business teams, that they would be able to work optimally and then drive similar performance from their teams. And the growth of that effort of investing in business executives continue throughout the 1970s. Well, we can actually go a little further back in this conversation. Early efforts in terms of wellness can date back to 1879 in the Pullman Company and their virtual city that they had just outside Chicago, and their effort to create sort of an athletic association that spent a meaningful amount of time making sure that everyone in their virtual city was well taken care of. I mean, they would even go so far as to build houses for folks who worked with the Pullman Company. They wanted to really address all of the issues facing their workforce in order to remove any obstacles or impediments to high-level performance. I mean, even in the community that I've been living in since 1980, the shoe company, Endicott Johnson Shoe Company, did the same thing. And you would move around the community, and for those who'd been in the community for a period of time, they would begin to recognize, oh, that's an EJ house. That's a house that was created or that was built on behalf of the workers in order to address some of their basic needs. So wellness in the broadest sense is an effort by the employer in this conversation to invest in things, to provide things that improve the life and life's experience for their employees and in many cases covered dependents. National Cash Register, when I discovered this or found this, I thought this was kind of funny. The CEO of National Cash Register back in 1880 used to take employees on horseback riding trips and whatnot in order to really get them exercise. They would have twice daily exercise breaks. They built gyms and exercise parks, and all of this activity was at its peak during that period of time from 1880 to 1911. Continuing this, some more recognizable employers, Hershey Foods, had built a fitness complex and a pool back in the 30s. Texas Instruments, Rockwell, Xerox, they instituted fitness programs in the 50s and the 60s. And then came along in the 50s, the notion of employee assistance programs. They were originally focused on alcohol, given the problem that occurred during that period of time, but expanded to more worksite types of programs. And so this is an example of an area where if properly packaged, the primary care team could genuinely supplant some of the so-called employee assistance programming information in a close collaborative relationship with covered individuals, with folks that are covered by the benefit plan. And so, you know, again, when you've seen one EAP, you've kind of seen one EAP. They each offer a different menu of services depending upon what they've been able to sell to the employer based upon whatever challenges the employer believes they have among their workforce. And also interesting to note, the EAP programs are a prepaid program. There is a payment that's made in advance, and it's either calculated on a per employee per month basis or per participating person basis. But it nevertheless is a payment that's made in advance that is designed to deliver an expected range of services in support of the employee and their eligible dependents. So again, there is similarity in terms of making an investment in a program between EAP programs and direct primary care. So we saw that worksite wellness expanded to all areas of wellness in the 1980s, where the employer didn't want to just offer programs that folks could take advantage of that were in the community. They actually wanted to make sure that it was on site and in close proximity to the worker. Now, today, what we see are worksite wellness programs and wellness programs that touch upon a variety of needs that individuals might have. And it depends upon the industry as to what smoking rates look like and whether or not smoking cessation is indicated. It's interesting to note that even though smoking cessation is delivered by primary care has gotten some level of recognition and some level of compensation in the fee-for-service world, the compensation for smoking cessation through primary care, for example, or frankly for any physician, is minuscule when you consider all of the effort that's required in order to get someone to move from being a smoker to a non-smoker. And I mean, it continues to this day that we are willing to pay more for the consequences of smoking rather than pay enough in order to genuinely create non-smokers out of smokers. Stress management, which is a more generalized term for good old-fashioned behavioral health. Again, a hallmark of early employer assistance programs, and but nevertheless offered in a very limited manner, because the employer by design is not able to really understand what the needs are of the covered individual without violating some privacy rules. And so they tend to offer more generic services or more generic programs and keep their fingers crossed that lo and behold, the stress management program that they have signed on to and that they are making available to folks on a voluntary basis actually hits the mark. And so that's frankly been part of the problem that exists presently in terms of wellness efforts, and why many employers generally think wellness doesn't work. Well, it only works to the extent that it's targeted, and present-day wellness efforts are considerably more generic in nature. Same thing with nutritional counseling rather. It really isn't counseling. It's just nutritional information that's put out there and efforts to maybe change up the food choices that might exist in a company sponsored cafeteria or vending service. But it isn't as targeted as it might need to be in terms of the needs of a covered individual. So, but nutrition counseling is among the so-called menu of services that are often provided as part of a present-day wellness program. Weight management, to a degree, goes hand in hand with nutrition counseling. The old adage, you can't outrun a bad diet. The notion that weight management itself is a fairly complicated conversation, depending upon who you're talking to. And then, again, we begin to see that while present-day wellness programs are often offered as menu choices, oh, I want the stress management program, there's zero weight management discussion involved in stress management, or vice versa. There's very little or zero stress management discussion involved in weight management. And the research is truly showing that there is a connection among all of these challenges for individuals, and that if you continue to offer services in a very siloed way, you'll have limited impact from that perspective. And then overall exercise and fitness. Again, exercise classes at the work site, having a gym on site, but not necessarily coming up with a plan that guides the person from a trainer perspective in terms of what sort of exercise is best for them to reach optimal health tends to be missing from the current efforts. And while they might bring in personal trainers and other types of individuals, there tends to be a limit to what they can do with folks and in dealing with the impediments that limit the person's ability to exercise. So as worksite wellness begins to expand, we see an interesting characteristic start to emerge among worksite wellness efforts. Lo and behold, preventive care shows up. Now, this is pre-Affordable Care Act, when preventive care became a mandated benefit under the health plan. And so rather than rely on the individual's personal physician to provide a service that would be subject to deductible and subject to a copay, or maybe even not covered at all, employers were sticking preventive care as a deliverable inside their worksite wellness program. And then they started to offer immunizations inside the worksite wellness program. Again, a service that you would normally think would belong to primary care, for example, shows up inside a worksite wellness program. So rather than look at primary care as a source for things, they began to, it seems, imitate primary care through their worksite wellness programs. And again, this is an opportunity to guide an employer in better understanding what primary care is capable of in order to guide the employer in terms of where their money is better spent. Screenings, again, now part of the so-called preventive care mandate under the Affordable Care Act. And again, even if the Affordable Care Act is eventually repealed and replaced, the bottom line is there are certain elements that were developed and identified, rather, that will carry forward, including preventive care and screenings and the like. Health coaching. They started to offer folks an opportunity to sit down with someone who would attempt to coach them regarding their health status. A lot of the early health coaching and present-day health coaching tends to be focused on a very narrow or limited disease state, for example, rather than more of a whole person type of orientation. So we want you to go see the diabetic health coach. We want you to go see the health coach who will help you with smoking. And so health coaching has been provided, but the person's role and responsibility with the covered individual has been inherently limited by design. And I contend that everything that the employers have been working on up to this point in time has been impacted by a lack of understanding around what primary care is capable of if given the opportunity. And part of the opportunity for primary care certainly is how they are compensated, which is why this whole conversation in and of itself is so important. Worksite wellness and now offers disease management, sort of an extension of health coaching, but maybe a little bit more aggressive than health coaching, because you're trying to now work on medication therapy management as part of the disease state. You're trying to work on nutrition as part of the disease state. But nevertheless, lo and behold, the worksite wellness effort is now beginning to look like what we would call primary care. And lo and behold, many of them are starting to expand, if you will, to the point where they are actually attempting to provide primary care or urgent care. And I would contend largely at the expense of community-based primary care, because it, for whatever reason, has not appeared obvious that what employers should consider is a relationship with community-based primary care rather than an effort to replicate and largely ignore community-based primary care. And that's been the theme of this whole conversation and the reason for taking some time at the recent Direct Primary Care Summit to sort of talk about this. Again, I'll say this and I'll keep saying this, that working with employers, it may not be right for every direct primary care model practice, but working with employers in this sense may lo and behold change up the dynamic in your community to the point where the entire profile of primary care is elevated and the opportunity for primary care is enhanced. So what's missing from everything the employer has been working on, depending upon who they are, horseback riding and other types of activities? Well, that very simple validation opportunity that wellness efforts actually work. There are all sorts of vendor-sponsored studies that have been conducted that suggest that wellness might work. But because of the variables that are involved and the estimations that are made, it hasn't really validated that what employers have been offering directly correlates to an improvement in health status and a reduction in their aggregate spend. And at the end of the day, any employer who has ventured into the wellness arena ultimately wants to improve their bottom line. You can say what you want about other types of good things that come about from this standpoint, but anyone who is in business, and frankly, I don't care if you are for-profit or not-for-profit, at the end of the day, for business, you're talking about profits. For not-for-profits, you're talking about revenue over expenses. And in both instances, any effort, any foray, if you will, into wellness, the justification has always been to prove it on the bottom line. And so what's been missing, frankly, is that validation that wellness actually works. And as a result, employers have been throwing wellness programs at their populations, hoping that something resonates with someone. And so there is a gap in terms of the relevance, rather, of specific wellness services in the context of that employer's population. So they offer what they've heard about. They may not necessarily offer what the employees and dependents need, and they may not offer it in an environment that helps to maximize the investment in wellness. So there is a gap in terms of the relevance of wellness services for a particular employer's population. And as a result, the lack of relevance, if you will, also has an impact on the ability to engage targeted individuals, those individuals who would be best served by a comprehensive wellness strategy. The employer offers it and then keeps their fingers crossed that the ones who really need it are the ones who gravitate to it. Often what they find is just the opposite. They offer the service and they find that those who are predisposed to improve their health status because they're already healthy to begin with, and as such have somewhat of an appreciation of their health status, are the ones that actually gravitate to it. And so that also has an impact on their inability to validate it because there is no population they can point to who have been dramatically improved by wellness. I mean, all sorts of happy people tends to be what they look at in terms of this is successful because everybody's happy with it. Well, if you're predisposed to it, the chances of you being happy with it are certainly better. So in terms of understanding the opportunity for direct primary care model practices as community-based practices, it's important to think in terms of what's missing from the wellness initiative on the part of the employer in order to better understand how to begin the conversation. And the most important piece is there continues to be pretty much zero accountability for results. So if it's not working, there's no one in a position to be able to talk about why it's not working. And so, and what the plan of correction is in order to make it work or have it be more successful. We've identified that there are pretty much three things that have to come together in order for wellness to really work. You have to have a source of wellness services and programming. You have to have the covered individual who is properly motivated to get involved in that effort. And then frankly, the employer has to be able to create an environment that surrounds both the covered individual as well as the source of wellness with a very supportive and reinforcing type of environment. If any of those three elements are not in play, then that's unfortunately where things begin to break down. And so the accountability piece has to take into consideration what environmentally needs to be in play in order for that accountability to actually mean something. And so, and frankly, that's part of what we do is we guide everybody through this process so that they have a much better and more tangible understanding of exactly, again, presuming this is where they want to go. I mean, if you're an employer with high turnover, which was a conversation we had in an earlier session, none of this is going to matter to you. So, a diagnostic question is, what's your rate of turnover? And is that something that you want? And if it's high and they say yes, because it helps keep my costs low, then I would say thank you for your time and move on, because they're not interested in this. So many of you have heard me continually refer to as a clinically valid wellness program or clinically valid wellness environment. Well, simplistically, it is truly a patient-centered environment that is able to really identify the needs of the individual patient and then organize care around the needs and services, care and services around the needs of the individual patient. And so if you think back to what I shared a few minutes ago in terms of all of these menu of wellness services, if they all continue to be offered in a very siloed fashion, where the employee or their covered dependent has to be the one making a decision as to whether I want to do stress management, nutrition, exercise, then often they are unable to really assess their own needs well enough, intelligently enough, in order to be able to leverage those services. So what primary care offers, and in particular direct primary care can offer, is that clinically valid environment in order to provide a well-rounded, properly organized wellness program. Because it can be organized, and frankly should be organized, around a couple of things: a clinical care plan and a preventive care plan. And a lot of the wellness that employers have offered up to this point in time have been offered without a real understanding of what the foundational clinical issues are for a particular individual. So they've been throwing wellness programming at an audience or a population, if you will, that doesn't have its act together in terms of its very, very basic clinical needs. And so, again, patient-centered, whole person-oriented, we think a clinically valid wellness program has that ability to organize all of this so-called wellness effort around a carefully constructed clinical care plan for the individual and preventive care plan for the individual, balanced properly. And then we think a clinically valid program would be able then to focus on services that are actually aligned with the needs of the population, and frankly stop offering certain things that don't relate to the needs of that particular population, or consider the development of things that are more closely aligned with the needs of that population. And again, I would point to, and to some degree pick on, EAP programs, employee assistance programs, because they will often lead with behavioral health as the issue, when that may not necessarily be, yeah, I know it's stressful times right now, but that may not necessarily be, for that particular employer's population, what the needs are. So if you want to do this with an employer, what do you need to know? If this is an area you want to go in and become part of, what do you need to know? Well, you need to understand that employer's existing wellness strategy. So before you present yourself as the best doctor in town, who will simply take better care of everybody, you want to have a better sense of where that employer's perspective might be coming from under their existing wellness strategy. Do they use a single vendor or do they use multiple vendors? And it doesn't really matter in terms of whether they use a single vendor or multiple vendors. Frankly, if they use multiple vendors, the opportunity, frankly, is better. But because there's a better chance of it being disconnected, not well coordinated. But even if they use a single vendor, the single vendor may still be using that mentality, or that menu mentality, that cafeteria mentality, where in order to control the price, they give the employer the opportunity to sort of pick and choose. Well, I want to offer this one, but not that one, instead of having an idea that they need something that is very well coordinated in order for all of it to actually have a chance of being successful. And then you also want to see to what extent can you explore the current investment in wellness. If you're going to ask the employer to redirect existing dollars, to repurpose existing dollars, it does make sense to have a better understanding of what the various elements of wellness programs tend to cost now. And so you simply get that from asking questions. What do you pay for EAP services? What do you pay for the on-site nutritional lunch and learns that are occurring every month or every other month? You want to get a sense of what their current investment is now. Now, it doesn't necessarily mean that what you want to do is simply do it for that money, because part of our effort with the employer in exploring what their claims data looks like, what their spend in healthcare has looked like over the past 3 years, is to help them see that there genuinely is a pay me now, pay me later type of reality here. That if they and we talked about this in a previous session, where certain employers by size, they're not spending much on primary care, which is probably why they're not getting much out of primary care, because they're not making the investment. They're not approaching this like an investment. But regardless, you do want to have a sense of what the current investment in wellness looks like by asking questions in terms of what they're spending for what. Then you want to be able to take a step back, if you will, and sort of begin to map your capabilities to the employer strategy. You want to rename some of the services that you would like to offer so that the names begin to sound like what they've been buying already. And so, we have a coordinated program that deals with nutrition and weight management. We have a coordinated program that deals with this and that. So you want to call it this. You want to call it, if you can, names as far as your capabilities are concerned. It also helps you start to think about what some of your gaps are in what you currently offer versus what maybe you could offer, either directly or through some sort of subcontract arrangement. I mean, in conversations with employers, I commend them for their investment in wellness, but I also suggest that, you know what, you really should explore the idea of having those wellness vendors become vendors to primary care instead of vendors to you, because it helps drive that accountability piece, because now the wellness vendors have to keep you happy as the primary care physician, rather than attempt to keep the employer happy, who really is not allowed to know as much as you can. You're a fully HIPAA-tized organization, and you can know more around what's being provided to the employees and covered dependents than the employer will ever be able to know. But you want to be able to map your current and planned capabilities to that employer strategy. And again, use their terms, not your terms, and simplify your message and your proposal and describe how you, as a one-stop shop for those covered individuals that gravitate to your practice, become part of your practice, how you will address stress issues, diet issues, exercise issues. Again, use simple terms that track with what the employer has been buying. And you'll find the conversation you'll have will be more on the same level in terms of understanding and appreciation. So you want to be able to do that. And certainly that is the kind of guidance that we can offer in order to get you to that point sooner rather than later. Listen to what services you provide and then help you make that translation. So with that, I see that we've gone a couple of minutes beyond the 40 minutes that we have been dedicating to the presentation part. And so, Craig, if you would see what types of questions we might have, we can go in that direction now.
At this time, we are going to open up the floor for our Q&A session. Those joining us by computer, you can use the microphone icon on your screen to unmute yourself and ask a question, or you can type a question in the chat box associated with the session. For those listening on the phone, you can unmute yourself by pressing *6 to ask a question. Appears that we do not have any questions at the present time, Jed.
Well, I would encourage folks to realize that there are no dumb questions, there are only dumb answers. So anything you ask.
Well, if there are no additional questions, we can wrap up a little early. Go ahead, Jed.
If one strikes you later, Craig, if you would offer my email address, folks can certainly.
Yes, it is J Constantz, JCONSTANTZ @EAHCS.com. So if you have any other follow-up questions or any other thoughts that you'd like to submit an email to Jed, you may do so. And I guess I would say that if there are no other questions, we would like to thank everybody for joining us today and hope that you all have a great afternoon. Thank you very much.
Thank you, everyone.